not be formally diagnosed with it. Joining us right now to explain it all is Dr. Robin Conley, a family medicine physician with Princeton Baptist Medical Center. How you doing again, Dr. Conley?
I'm well. How are you?
Great to see you once again. I am good. ADHD, to clarify for our viewers, what is it?
ADHD is attention deficit hyperactivity disorder. It's a chronic neurodevelopmental disorder, usually affecting about 11% of our school-age children, but sometimes it can continue into adulthood in more than 3/4 of many cases out there. ADHD is characterized by developmentally inappropriate levels of inattention or focus, impulsivity, and hyperactivity.
Yeah, so how different is ADHD to ADD?
So in 1994, the name of the disorder was changed in a way that confused people. And since that time, all forms of attention deficit disorder are officially called ADD or ADHD, regardless of whether the individual has symptoms of hyperactivity or not. So even though these are the official labels, a lot of our professionals and even lay people still use both terms interchangeably, but they're both really essentially the same idea.
Yeah, so you said it can grow into with adults and stuff like that. I have a tendency, I always wondered, do they grow out of it or do they learn or mature to be able to control those type of impulses? What?
Well, that's a great question. Actually, we do have lots of children who do end up growing out of it. They may have been treated with medication for a short term or even gone through therapy or both, and those symptoms will diminish or they get to the point where they can cope well with them and help to control those impulses, but they may reappear in adulthood, especially depending on your lifestyle, the kind of job that you work, and how much other factors like depression or anxiety play a role.
Yeah, I got a couple of more quick questions for you. The symptoms for ADHD, what are they?
Okay, so the most common symptoms patients complain of with ADHD would be inattention or poor focus. They'll tell you that, they're working on 2 or 3 projects at the same time. They can't complete any of those tasks. Inattention to detail, meaning they can't really focus on specifics of a thing, whether it's a conversation or, a task at work. They're easily distracted. So, the same idea of that movie, where you hear squirrel.
Yeah.
That kind of idea where you can be very easily distracted and take your attention off of what you're doing. They often have trouble listening. They may even have symptoms of anxiety, feeling jittery, because they can't complete those tasks.
I got to ask you one more before I let you go. Medication, what's the situation right now? Because we've talked about in the past about a shortage with it.
Okay, well, right now we're treating with stimulants or non-stimulants, the most common being Adderall or dextroamphetamine. There has been a shortage in the community, not just here in Alabama, but actually nationwide. And so sometimes we have to use alternative therapies like Vyvanse or Strattera, which are non-stimulants, just to kind of, keep the symptoms of our patients at bay. And so right now you may have to do a little shopping around your community. If your pharmacy isn't carrying your medication, you may have to try a different pharmacy and keep shopping around. And sometimes just a full alternative is necessary.
Good information right there, Dr. Robin.